my God. Okay, so my quote is, "The best way to find yourself is to lose yourself in the service of others." My name is Jessie Murray, and I'm a senior at Frisco High School, and my topic is pediatric nursing. The reason I chose that quote is because I like helping others, and I love volunteering, so that is why I chose pediatric nursing. A little about me is I'm always like the mother of the group. I'm kind of always like watching out after everybody and cleaning up. I volunteer at Children's Medical Center during the summer, and I love it. Last year I got to work in the surgical playroom, and it was really fun to play with the kids before they like got to go into like the unknown, and they didn't know what was going to happen, and they were scared. So it was nice to play with them before and to kind of relax their minds. I'm kind of shy at first, and I sit back, and this is my second year in ISM, which has really helped me with being shy, and especially with giving speeches and like approaching people. It's a lot easier now. Why I chose pediatric is because I adore children. I work with kids at an after-school care, and I have kinder in first grade, and I absolutely love my job, even though they drive me crazy sometimes. I want to make a difference, especially with kids that are dealing with sickness. I really want to focus on oncology, so kids with cancer. And so I know that they're going through a really hard time, and I want to kind of be the light in that and educate them and help make their process a little easier. Nursing and working with kids is really rewarding, and it reminds you how blessed they are, because kids are so innocent and they're fighting every day, and they're not very lucky to have that, and they're like, why me? And so you really look at it and realize that you're lucky, and you shouldn't take every day for granted. This is a picture I found, and it's what cancer cannot do. Cancer is so limited. It cannot cripple love. It cannot shatter hope. It cannot dissolve faith. It cannot destroy peace. It cannot kill friendship. It cannot suppress memories. It cannot silence courage. It cannot invade the soul. It cannot steal eternal life. It cannot conquer the spirit. My mission in the Independent Study Mentorship Program is to conduct research and gain hands-on experience to acquire a better understanding of all the tasks a pediatric oncology nurse performs daily. With the help of a mentor, I plan to learn how to deal with the emotional career as I work to develop a product related to my field of study. In ISM, I am looking forward to growing not only as a person, but also in my knowledge and love for nursing. So my ISM journey so far, I've gone to the Business Symposium, which was a very fun and like kind of getting out of my comfort zone experience. It showed me professionalism and how to handle an interview, how to not only like answer questions professionally, but also to ask questions to show that you're interested. Then we went on a field trip to UNT, and I was supposed to sit in an anatomy class, and when we showed up, the professor wasn't even there. It was his assistant, and they were taking their final, and they were pretty much done for the semester like 4 weeks early. So it was kind of interesting, and I didn't get to sit in the class. So then I sat in a business and communications class, and I definitely know that's not what I want to do. Then I conducted some research and just kind of learned more about my field and nursing, not just on oncology, all about nursing, the different parts, not necessarily like the scientific part of it, but the communication and what you need to do in school. And then I went on some interviews, and I met some really great professionals that kind of helped me steer in the right direction. And then I found a mentor finally, Mr. Higginbotham, and then we worked on my original work, which kind of showed all the research I've done this year. So for research, I learned the daily duties that a pediatric nurse is responsible for, which is just like administering IVs and medication, kind of just doing your rounds, checking on them. You have to educate your patients and their families, especially working in pediatrics. You're not just working with the kids. Like, you have to go everything through their parents first. And you have to like guide them to a healthy lifestyle. So once they've gone through their treatment or whatever they're in the hospital for, you have to help steer them in the right direction for the future, so they don't come back, or so they can be aware of symptoms if they're like having a reoccurrence. You have to support them. It's a scary time in their life, so you kind of want to help, just kind of calm them, let them know that everything's going to be okay, that I know it's a scary time, and I don't know what it feels like to be in that position, but I know how to help them. And then providing the best care possible for the patients. One of giving them the best care is being honest with them, even though it might be hard and you don't want to tell them, oh, you have 6 months to live. It's not really your responsibility to do that, but you can't just be like, everything's going to be okay, everything's going to be okay. You have to be like, this is what we can do from now on, and this is what we're going to do to be proactive. But you can't lie to them and say, oh, don't worry about it, because you do have to worry about it. And and they would be really upset if you found out that you were lying to them. Communications with the patient is very important, especially for me because I'm kind of shy. So you have to identify what the patient needs, and if you can't talk to them and ask them questions or have them feel comfortable coming to you, because they're going to be scared, so they're going to be quiet, so you kind of have to get it out of them, what they need. You have to be honest with them again. Trust is a big thing. They have to trust that you're caring for them in the right way, especially like pediatrics, that their parents are at work, they're there alone sometimes, and you just have to have them trust you and kind of be like a second mom to them. I read an article by a pediatric nurse and about him taking his work home, which some nurses say it is not okay. You have to put up a wall and know when you're at work, you're at work, and then when you're at home, you're at home. But he said it is okay to get emotionally invested in your work and build a personal relationship. You do have to know your boundaries, that you still are a professional, but it's okay to like have that personal bond with them. You want them to feel special. You don't want them to feel like a number in a hospital, which really stuck out to me. But you also have to take that time for yourself. You have to know that it is work. So it's just a balancing act. Then the next time was me time. And it was an article that I read by a nurse that was saying that it is such an emotional career. You're always helping others, that you have to take some time for yourself. They said that spend your first paycheck on yourself, kind of reward yourself for helping others. It can be draining, and it's long hours, so you do need that me time, whether it's with your girlfriends or just a night alone, and just kind of refocus and regroup so you can be the best at your job. Then I went on some school tours. I went to University of Arkansas, and it had a really nice and advanced facility. It was new. My favorite part of it, like they had video cameras in the labs. So like when you were to be working on like a dummy to practice before you go in the hospital, it would record you, and like you will talk, and like the nursing instructor will be talking back to you. So, and it like records your whole and how you react into this, like the situation, especially in an emergency. So you can look back and see like what you did right and what you did wrong and help you improve. And what I loved most about it was that you didn't get graded on whether your patient died or your patient lived and like what happened. It was just an all-in learning experience. They really wanted you to succeed and be the best that you can be. And they also do a point system, which is the first nursing school that I looked at that did it. So they like, not only did they just look at your GPA and your sciences, they looked at like whether you went to Arkansas for your first 2 years to get your prereqs, if you were in honor classes, and then they just like kind of averaged everything in, and then your grades were a certain part of it. Your GPA as a whole was in there, and then your science grades, which were a little different. So I didn't really like that part about it, just because that when you go to nursing school, that they only take a select amount, so there might be 500 people and only 150 get in. And so like I want to be able to apply to many different nursing schools that I know I have a chance at, and I know that if I go to University of Arkansas for nursing, I pretty much have to go there with my prereqs to get in. And then I looked at the University of Oklahoma, and they have 3 different locations, which I really liked. So they have it in Oklahoma City, Lawton, and Tulsa. So if I didn't get into like one of their locations, I could get into another one. It's a smaller program, but they really are there to help you. They want hands-on. They want the teacher really working with you. They also have a program with the government that they really like, and other schools have it too, but University of Oklahoma was the first one that kind of told us about it and really encouraged it, that if you work in like a rural area, that they will help, the government will pay for your schooling. So if you do like a 2-year contract with a hospital to help out in a smaller area, they'll repay like your school debt. So that was kind of nice. And then they also have a children's hospital on their campus, which that was the first nursing school that actually had a like pediatric hospital on their campus. Most nursing schools, their hospitals off campus. So it was really cool to see like their children's hospital, and in that children's hospital they had oncology, which was very appealing to me. Then the next thing I did was showing up on the oncology floor, and it was a nurse that has worked in oncology for a long time. She worked at St. Jude's, and she didn't get on right away, but every time that she see a job opportunity there, she would go and apply. She was not giving up. St. Jude's was her dream place to work. So she said, never give up on it. If that's what you want to do and you love it, just keep going. You will eventually get where you want to go. And she said, you can't judge, because she used to parents that would be at work while their child would be in the hospital. She'd be like, why, they're an awful mother, like, why aren't they here with their kids? But she realized after she got into it, like, they have to make money to pay for the bills so their child can get the best treatment. And she said it was hard for her, like, being a mother, seeing that. But she said that it was her job to step up and be the second mom while their mom couldn't be there and love that child. And she said it's also your job to be on the same page as a family. Like, you have to educate them and let them know, like, what's going on each step. If something's going on and they're at work, you have to give them a call and let them know so y'all are on the same page and y'all don't get lost and it not work out so well. So then I did some interviews. My first interview was with Miss Gaffney, and she is an elementary nurse at Allen. She was my mentor last year. I actually had two, and she was one of them. She graduated from Frisco High School, and she worked in the ICU at first, and she liked it, but it was really hard on her seeing patients so sick, and most of them didn't get better, so she switched to the wellness side. And with school nursing, she always sees, her kids come in with, bumps or scrapes or sore throat, fever, but then she'll see them in a week later and they're fine. And she loves seeing that people were getting better. She said it's perfect for raising a family. She said she works normal hours. It's not 7 to 7 shifts, and she's not working at night, so she has time to spend with her family. And she said you have to study your butt off in school. She said nursing school does not come easy. It is a very competitive program, and she said if you want to do it, you just have to discipline yourself, and you'll have time to have fun. And you can still have fun in college, but she said focus on your schoolwork, and once you get to where you want to be, she said you'll have time to have fun. Then my next one was with Mr. Higginbotham, and he is a pediatric nurse at Children's Medical Center, the Legacy campus. He used to be an oncology nurse. He's worked in different parts of it. He was a nurse supervisor, and then he'd go back to oncology. Then he'd do nurse supervisor. And then he went to Children's, where they had, from Medical City, where they had an oncology unit, and it didn't work out. So now he is just an oncology nurse, and he sees kids healthy and in a better place is why he liked oncology. He said, he got to see them that weren't so good, and now they're relieved and into a better place. Then he said his advice for me was to not be afraid to ask for more money. He said, usually when you're getting hired, they'll say, this is what we're going to give you for pay, is that okay? And if you ask for a little more, they either will say yes or no, but it's not like they're going to be like, oh, you can't get the job anymore. So he said it doesn't hurt to ask. He said it's just going to help you if they say yes, and maybe you can meet in the middle somewhere. I really liked him because he was honest and he really showed his passion about nursing. Then I interviewed Christine Ellis, and she used to be a pediatric nurse at Children's in Dallas, and she is going back to school right now to get her master's. She wants to really teach nursing. She went to the University of Arkansas, so when she found out that I was looking there, we had a lot of talks about that. Her advice was that it's okay not to know it all, and someone will always know more than you. Don't feel bad that someone knows. She said that you're caring for someone's life, so you have to be able to ask questions and admit that you don't know, and that because if you just kind of like are whole pride when you don't want to like know that you don't know the answer, then you can make a mistake and it's somebody else's life. Then my next interview was with Miss Minton at Medical City Dallas, and she is a pediatric oncology nurse, and I absolutely loved her. She was so sweet. She said the most important part about nursing is knowing her boundaries, and she said she's been very good about it, except for there was one patient that slipped through those boundaries, and she said the hardest thing is losing that patient, and she said it is so hard to keep those boundaries, but she said it is necessary or the career will tear you apart. She said you have to educate parents. The doctors see them for a while, but you're with those patients all the time. You're in the room checking on them. When they go home, you have to be the ones to educate them that their immune system isn't there and they will get infections, and that can take their life very fast if you don't act on it. So she has to, give them, if this happens, if they have a fever, this and that, they need to come back into the hospital. And she said the thing about oncology is things can change in any minute. And she said you have to act fast, but you have to act calm, because the parents are with them 90% of the time. And if you're freaking out, and the parents are going to start freaking out, and the room gets crazy, and it's hard to get good work done. She actually is not going to be doing oncology nurse anymore because it was such an emotional career that she said she needs a break, and she loves it, and she hopes to go back. But at like this time, she needs to just kind of take a break from it and do something that's not so emotional, and seeing kids pass away a lot. But she said there are people that have done it for 20 years and absolutely love it and couldn't see themselves doing anything else. So it's kind of nice seeing, like, I got to meet some of the nurses that have been doing it for 20 years and they love it. So I know that if I do love oncology nurse, like, I could have a job for 20 years, but if I don't end up loving it, there's also other parts in nursing that I could do. Then my last interview was Miss Smith, and she works at Forest Park Medical Center, and she is an OR nurse manager. She was an OR nurse for a long time. She worked at Parkland in, like, the emergency OR, and she loved it. But then she had a family, and she came and started being a nurse manager at Forest Park. And she said that it's a balance between work and play. Like, as much as you want to do your work, you have to have all your stuff done, especially as a manager. You're making sure everything's in place for all your other nurses. But she says that she does have a family, and she knows that it's important to have time, play with them, have fun, get work off her mind where she's not stressed out about that, and take it out on her kids. And she says as a manager, you have to stay neutral because there's always, like, 8 different sides to a story. There's so many different people in the OR, and you have to stay neutral or everybody will start getting mad at you, and then it doesn't work very well in the OR, and it's very hard. So she said stay neutral, listen to everybody's side, and just come up with a solution instead of blaming anybody. And then she took me on a little trip around the OR, and I got to see lots of different surgeries. I got to see a few hysterectomies, and I just got to stop in, and then I, like, saw the beginning of them when they were going in the body, and then I got to see them while they were actually doing some work. And then I got to see them prepping a patient, what the nurses do, prepping the patient with an arm surgery. And then I got to see how they put a spine surgery patient, like, that's a different bed and they have to be face down, and how you have to lock all the different parts of the bed, because if not, the patient will completely fall in while you're working on them, and that would pretty much just kill the patient because you have their back open and working on their spine. It wouldn't be very good. And then my mentorship, I picked Mr. Higginbotham at Children's Medical Center, and he's a former oncology nurse, so he could give me some, like, tips on that and help me with that. But he also was in a different part, so I could see different areas of nursing. He was very honest with me about how he picks his jobs. He said that he wouldn't pick a job that he didn't believe in. If he didn't believe how the doctors and the team ran, he wouldn't work for that. And I love that he said that, because he knows, like, what he thinks best for the patients, what he believes in, and he's not going to do it just for a paycheck. Like, he wants the best for his patients, and I really loved that part about him. And then he was really experienced, so he could give me lots of advice, and he loved talking about his job, and he was very passionate. My original work proposal was to make a patient plan created by the patient's medical team. And so it's like the doctor, the nurse, the surgeon, the family, they all come together to make a plan for the patient. I researched leukemia from the diagnosis, the tests done, chemotherapy, drugs, and course of treatment. And as a nurse, I will play a major role in a patient's health plan, not really creating it, but implementing it. Like, the doctors are there for a certain amount, but I have to give the treatment, I have to record all the documents, I have to see how the progress is going so I can report to the doctor. So some of the research was just who's a part of your cancer team. Will be led by the patient's oncologist, which is their doctor, and then their nurse, and then there will be 2 primary team members who, like, care for the patient. And then an oncologist is a doctor, like, who specializes in the diagnosis and treatment of cancer, and then they design a treatment plan and the follow-up care for the patient. And there will be, like, many different oncologists, and it's like the medical who treats the cancer with the medicine, surgical who treats the cancer with surgery, and then radiation who treats the cancer with radiation therapy. And then the oncology nurse is the nurse who is specially trained to care for the cancer patients and their families. Especially with pediatrics, you're not just working with the patients, you're working with their families. And then the nurse works with the patient's doctor during the course of the care. And then the duties include monitoring the patient's physical and emotional health, because it takes a toll on them, especially with chemotherapy. It takes a toll on their whole body and everything else. And you have to make sure that they're physically and emotionally ready for the next step of their treatment. You give the treatment to them, and so you're doing the IV administration. Like, the doctor does all the dosage, but you're the one that gets it out, puts it in them, and, like, gets everything going. You have to educate the patient and their family on how to prevent complications, how to reduce the side effects, and how to care for the patient at home. And then there's many different people who will be a part of your care team: behavior medicine specialists, clinical directors, and primary nursing care coordinators, clinical research, financial counselor, cancer and chemo and treatment, all that. Very expensive. There's the nurse practitioner, the physician assistant, the clinical nurse specialist, the dietitian. A lot of them get sick and they can't keep down food. There's a fellow, there's the pharmacist that gets their drugs, the social worker, the pain management, and the list goes on and on and on. So some of the research I did was like the symptoms of when they're diagnosed, the fevers, the weakness, loss of appetite, just little things to look for. Then the drug information, like what drugs like interfere with each other that can't be given at the same time, like the dosage, the effects they can have. Then I have a little chart up there that has like the dosage with their weight and their height, and the treatment, the stage of the cancer. And then there's my chart that just has the basic information of the patient, the symptoms they had, if they, tobacco, what type of cancer it was, when they were diagnosed, if it's new or if it's a reoccurrence, if they need surgery, what kind of surgeries they'll need, what their blood counts were, what stage of cancer it was, if there was tumor markers, the location where it was, then the treatment plan. You have to record their height before treatment, after treatment, their weight before treatment, and after, if they're on a clinical trial, if they're not, what kind of chemotherapy drug they're on, the dosage, the route they'll be given, the schedule, like if it's every day or of the week, is it day 1, day 3, how many times they're going to get it, and then side effects that they're going to get from the chemo, like hair loss, nausea, low blood count, fatigue, and all that. So in the fall, I will be attending the University of Oklahoma, and I am pre-nursing as my major. I chose the University of Oklahoma because of their nursing school. Even though it's not known for their nursing school, they do have a great program. Their pass rate is great. They have on their medical campus, it's like most nursing schools are on the school's main campus or at a different campus, but it's on their medical campus, so it's with all different medicals, the doctors, like dentists, all that is all together, and I love that. And they also have the oncology with the pediatric, and most nursing schools don't have pediatrics, so that was very appealing to me. I'm excited and looking forward to my rest of the year in ISM. Boomer Sooner.